Good day to all of you, colleagues, and I welcome this opportunity to speak to you in my capacity as the UN Special Rapporteur on the Right to Health. My name is Dr. Tlaleng Mofokeng. We are sick from genocide as we continue to witness this horror that Gaza is currently going through and its people, the display of recalcitrant but also repugnant attitude of an occupying regime and its global allies. The Gaza Strip is not a natural geographical unit. It is not an island or a country or a hostile entity in need of any management or pacification. And yet the continued displacement and systematic and violent expulsion of the majority of Palestinians from their homeland continues to create one of the largest and protracted refugee and humanitarian crisis even before October 7th, 2023. Since March the 2nd, when the second phase of the ceasefire was due to begin, Israel had blocked the entry of all goods and humanitarian aid into Gaza, including fuel, medical equipment, and other essential supplies, including cutting off access to UNRWA, which is the largest and most involved UN entity in Palestine. Not only is Israel killing and causing irreparable harm, but Israel and its allies are knowingly and intentionally destroying any underlying social and economic and civil possibility necessary to ensure and sustain life. Israel, an illegal occupying power, and its allies have ignored the International Court of Justice. And of course, as the UN Special Rapporteur and many of my colleagues, we continue to commit to making sure that the issues that affect Palestinians, Gaza, specifically the issues of genocide, these immeasurable measures of violations under international human rights law are not forgotten or made invisible. At least 670 health attacks have occurred from 7th October until March, including 122 health facilities which have been affected, 33 hospitals damaged, and of course, colleagues, we know that these numbers are gross underrepresentation. And I say this because my mandate and I have received and acted upon information regarding the deliberate obstruction of medical supplies, denial of evacuation for medical treatment, the harassment, intimidation, and detention of healthcare workers, including, of course, arrests of our colleagues under circumstances where they were helping and treating their own patients, reportedly being beaten in prisons, and of course, we know healthcare workers and doctors who've died with their bodies showing signs of torture. I have communicated to the member state of Israel my concerns in an urgent appeal, many urgent appeals. And of course, this communication continues to try and bring to the fore the issues that affect human rights, that affect the right to health, but that in fact a genocide is incompatible with the right to health. And more importantly, to try to end this impunity that currently we see in full display. It is most frustrating that some of the interventions and the methods available, for example, an independent expert like myself, I feel often that I'm not doing enough, that the global community is not doing enough. But I find courage in the moments such as this where we can collectively come together to see for ourselves that the actions that we take in the different levels of work that we are, in the different spaces where we are, actually matters ultimately. And this brings me to one of the most infuriating issues, which is the global silence of medical and health professional and organized bodies, their lack of solidarity for our own colleagues facing bombardment and violence and attacks while participating and performing their duty. This silence must end. Al-Ali Hospital was hit by an airstrike on the 13th of April, destroying the emergency department, causing irreparable harm, causing death and destruction. And yet, our own colleagues the own medical fraternity, organized medical professional bodies continue in silence. And with this latest attack on the health system, the options for healthcare, especially for emergency healthcare, for the people of Gaza are reduced to zero. And Israel continues to operate with its impunity. And the heroic actions of our own colleagues in Gaza does not mean just because they took a medical oath that they should be the ones who are bearing the brunt of a depraved humanity. For 2025, I will address the Human Rights Council in June, and will also address the United Nations General Assembly in October. And there I will be presenting with them a report on health and care workers as key protectors and defenders of the right to health. And it's my hope that both these reports, one in June and in October, will support, will assist, will provide evidence, witness, and an understanding on why healthcare workers' human rights are important to be upheld and protected, for the right to health to be realized, and of course, highlighting the context of protracted war and conflict, and specifically genocide, and why it's increasingly important to be anti-racist, anti-colonial, and anti-imperial in how we think, perform, and practice medicine. For the sake of peace and security, development, and ultimately for justice for healthcare workers in Gaza, but also healthcare workers everywhere who are working under conditions of war and protracted violence. It is important to keep that unwavering solidarity, to keep pressing and demanding that the rights of healthcare workers themselves, first as workers, be protected so that they are also enabled, therefore, to protect and promote the rights of their patients. What we need right now in this context of the destruction of the health system in Gaza is an immediate unconditional ceasefire. We need an end to this illegal occupation. We need an end to the genocide. And peace will only follow liberation. So any idea of a peace process that excludes, continues to marginalize, bombard, exclude, and exterminate the Palestinian people will not lead to ultimately a sustainable, peaceful area, but also it will not lead truly to liberation. And therefore, the people of Gaza, in pursuit of true liberation, must be supported, must be given the space to determine for themselves what it is to be Palestinian, what it is to have a vision for your own people, for your own community, and for your own country. And of course, we shouldn't forget how difficult it has been in terms of the timeline of the genocidal plans. October the 7th is when the plans came to life, but they've been in motion all along in many different ways. And so my commitment as a mandate holder from the United Nations is to continue to speak up, to not be silenced, to push back against the harassment, and to ensure that the issues of the right to health, which encompass the right of everyone to the highest attainable standard of physical and mental health, are also realized for the people of the occupied Palestinian territories. And I continue in solidarity and in support to demand the release of all healthcare workers under the brutal detention imposed by Israel, and call on the release of Dr. Hussam Abu Safia and all of our other colleagues whose names we are yet to even know. And it is with that impossible rage and fury that I want to end my contribution, but also to say thank you to all of you, because we are keeping each other alive. We are keeping each other as a source, as a resource to keep doing this very difficult work. And I just want to say thank you again for affording me the space to be able to join you in my capacity as the UN Special Rapporteur on the right to health. And I'm Dr. Tlaleng Mofokeng. Thank you very much, colleagues.